Hello viewers, welcome to NRG Healthcare. I am Dr. Akila, consultant diabetologist. Wish you all happy Pongal. Today's topic is related to Pongal. So we will discuss which sugar item is good. As I discussed in previous video, I want you to look at the food item in three different categories. First one is how much calories do they give? And the second one is the calories are coming from which group of food item, whether it is carbohydrate, fat or protein. The third one is what are the additional benefit they have, like what is the glycemic index of the food, whether they do have fiber content or not, what are the additional nutrients like vitamins, minerals they have, and also if it is a fat containing food, whether it is a saturated fat or unsaturated fat, whether it is a good or bad fat. So let's discuss the important sweet items. Here I am taking white sugar, brown sugar and honey because these are three common things we use to sweeten the food item. So coming to the caloric level, the calorie content for sugar item is 1 teaspoon has nearly 20 calories. So, whether there is any difference in the caloric level of these three sugar items? Not much. So, they all carry more or less similar calories in there. The second one is where the calories comes from. Okay, these three sugar items are purely carbohydrates. So, there are no added nutrition value except minimal vitamins and minerals. I will discuss in a bit. And there are no fat or protein content. So third, what is the glycemic index of these sweet items? So refined sugar, okay, when they prepare the sugar, usually they are from sugarcane plant, okay, they get the extract of sugarcane and they treat the sugarcane plant extract in factories to remove that pigment and crystallize the sugar. That is a refined sugar, where they remove all the added substance from the sugar. This is refined sugar. Brown sugar is still they have the substances called molasses which gives pigmentation to the sugar. And they do have some vitamins and minerals. So the refined sugar, the glycemic index is very high. So the glycemic index of the food is defined as how quickly the food item increases the blood sugar levels. Okay, so the refined sugar increases the blood sugar level quickly. So it has a high glycemic index. So compared to the brown sugar and honey, especially honey which has lower glycemic index. And also the sugar type, the honey has fructose which is more sweeter than the sugar content in the refined sugar. So coming to the vitamins and minerals, as we discussed, it has some nutrients. Okay, for example, potassium, magnesium and vitamin B riboflavin are all present in the honey and brown sugar. Third one is whether it has any fat or protein. It doesn't have any fat. So we come to know that all the sugar item has similar caloric value. They all come from carbohydrate. So it will increase the blood sugar levels. And if the blood sugar is not utilized in the body, it will change into fat and get deposited in the body. Okay, so it is important for the diabetic patients to choose their sugar type and also very stringent about how much sugar they use. Okay, because I discussed 1 teaspoon has 20 calories. So for a person who take 2 times coffee or tea with 2 spoonful of sugar, the caloric value increases into 80 calories, okay, of the daily requirement. And it is the empty calorie which does not have much nutrition. Even though it has little bit of minerals in brown sugar and honey, it is not much to improve the quality of food. So you have to be very specific about the amount of sugar you use irrespective of which type of sugar you use. Why I am insisting is it is very easy to increase the calories in your food and it is very difficult to burn that calorie. For example, one serving of sweet pongal which has around 290 to 300 calories. To burn that calories, you need to do active exercise for hour or to 1.5 hours. Okay, depends on the exercise type. Same thing, a gulab jamun has around 140 calories and it takes half an hour to 45 minutes exercise to burn that calorie. So it is very easy to increase the caloric content of the food. So be cautious about the quantity of sugar you take. And the second thing is, we all get used to different food items. Okay. So for example, if you are a person who is taking 2 spoonfuls of sugar, gradually you reduce the quantity of sugar in your coffee or tea, you will get used to that. Okay. So you can halve the sugar or you stop the sugar. Okay. So this is the best way of getting the sugar into your body for diabetic patients and even for non-diabetic patients who want to maintain their weight or lose their weight. So any type of sugar, take it in a minimum amount or without using the sugar, try to take your coffee or tea. Thank you for watching.